Welcome back to the channel. Over the last 17 years, I have had the privilege to work with many physicians over the years in helping to restore sex hormone balance in both women and men. Every day I am counseling patients on proper hormone restoration. I'm helping physicians interpreting test results, and most importantly, I'm helping both men and women to regain optimal wellness in all aspects of their life, and hormones play a huge role in that, in my opinion. In today's video, I'll be sharing with you 3 important topics that relate to hormone balance. Number 1, we'll be looking at metabolism. It's important to know that actually estradiol can help with proper metabolism. It can also help to improve glucose tolerance. Number 2, we'll be looking at hormones and how that relates to mental health. There is a huge mental health issue, in my opinion, in this country, and hormones certainly play a significant role in that. We'll look at how estrogen, specifically estradiol, can help with serotonin balance in the brain. And thirdly, I see this every day at the pharmacy. We have women coming in and they have issues with osteoporosis. I'll be looking at the medical evidence that is out there related to hormone balancing and how that helps to improve bone tissue integrity. Let's get into today's content. I hope you enjoy the video. I forgot to mention, at the end of this video I will be sharing with you 2 tips. One, on how to locate a doctor that is well versed in restoring optimal hormone balance, and I will also be sharing with you a simple at-home test that you can pick up here at the pharmacy to get yourself started on the journey on balancing out and optimizing your hormones. All right, back into the content. They play a very important role in preventative medicine. So that's a key thing too that I'll be driving home tonight is, again, I'll use that patient from 2 days ago, 70 years old. You know, she doesn't have hot flashes or night sweats. That's a lot of times when that menopausal woman comes into our store and they want to get that resolved. But what about their bone health? What about their brain health? And I was explaining to that patient, you know, there's hormone receptors on every cell of your body, just about 99.9% of all the cells in your body. There's a receptor for estrogen, for progesterone, for testosterone. In my opinion, those receptors are there for a reason. God just didn't put them there just because he had some extra receptors left over and decided, well, let's just stick them on these cells. They play an important role, so let's figure out what that role is and keeping the body optimal. I'm going to keep saying that word because, you know, when I look at ranges, and Monica does this way more than I do, but you're looking at hormone ranges, and I do see this every day when I consult with patients. We look at their labs, and I hear this. I do hear every day. My labs are normal. My doctor says I don't need anything. They're in the normal range, or they're in the range, but are they optimal? So I'm always thinking of optimizing hormone levels. I'm not just thinking about, oh, you're in the range, you're fine. It must be something else. You know, here's an antidepressant. That's maybe why you're depressed. So. And I said this point already too, but I'll say this again. So pharmacological benefits and risks of synthetic hormones are not the same as bioidentical. So what is a synthetic hormone? I listed off a couple examples already, but like your Prempro, your birth controls, your Premarin pills or cream is not the same as progesterone USP or estradiol USP or testosterone. Did I say that already? So estradiol, progesterone, testosterone in those formats. That's not the same as norethindrone or ethinyl estradiol. So I just want to make sure that we're all understanding that. So when I talk about benefits tonight on hormones, I'm talking about bioidentical. So metabolic health. So looking at bioidentical hormones actually helps you lose weight. So how can that be? Sometimes patients will come to me and they'll say, well, estrogen causes weight gain. Well, it does cause water retention. It can if you get too much of it. And estrogen makes our fat cells a little bit happier. And then when you have more fat cells, they love to produce estrogen. So then you've got more estrogen producing more fat cells producing more estrogen producing more fat cells, and it just goes around and around and around and around. But that's if you're getting too much. But actually, if you get the right amount of estrogen in the bioidentical format, it can actually help with weight loss. And then you combine that with progesterone, which is a diuretic. So now that estrogen that is causing water retention, if you get too much, you've got bioidentical progesterone around and you're getting rid of that water because progesterone is a natural diuretic. So So estrogen, and again, I should have probably wrote physiological amounts, but in proper amounts helps to reduce or helps to keep weight optimal, reduces abdominal fat, improves glucose tolerance. Again, if you've heard any of my other seminars, the issue with a lot of weight gain is where you get insulin resistance, and so your body is continually having a hard time dealing with carbohydrates, and so again, in the proper amount, estrogen can help improve that glucose sensitivity, or I should say that insulin sensitivity. Metabolic health from estrogen. Estrogen protects microbial diversity. So why is that important with the metabolic function of the body? So when you look at the gut bacteria, they actually, if you have healthy gut bacteria, you can burn fat more effectively, you can lose weight more effectively, and so that estrogen promotes good bacteria. So if you've got good bacteria in your gut, you're going to do a better job losing weight. Research indicates diversity is crucial for healthy metabolic profile. So there was this study done, there was multiple studies done, but this one in particular looked at dysbiosis. If you have a lot of bad bacteria in your GI tract, you're going to turn on genes that activate inappropriate carbohydrate metabolism in overweight individuals. So if you go on a course of antibiotics continually, you are creating this dysbiosis in your GI tract. And then you have an issue, then you've now just turned on genes that inhibit your body from metabolizing carbohydrates effectively. Now this is subtle. This wasn't like something where you're going to gain 20 pounds after you take an antibiotic or anything like that. But if you compound that with a postmenopausal woman that's already estrogen deficient, you can see how you're setting yourself up for some issues here. And so we have to look at these things as, as a whole picture of a patient with dysbiosis or some IBS or some kind of inflammatory bowel issue that, part of this is let's get that GI tract working properly with the right bacteria, but let's also potentially combine that with estrogen if that's appropriate. So again, how do we know that? Let's measure their level and see where their estrogen level's at to begin with. So depression and I think we all know this, but it's very complex. There's a lot of different reasons we can suffer with mental health disease, and especially depression. There's a lot of receptors, there's hormones, there's neurotransmitters involved, there's our diet, there's our sleep, there's a multitude of different pieces to this puzzle. One of those things that, again, I don't want to leave out, especially for, and men too with testosterone, but postmenopausal women for sure, that those estrogen levels start to drop, and progesterone especially works as a natural antidepressant. That starts to taper off. We start seeing these issues with mood. Again, every month I have patients telling me, I'm sad all the time, I'm crying for no reason, there's a lot of mental instability, and we go and measure their hormones, and their progesterone's almost not even there. Their estrogen is, again, might be still in the normal range, but it's on the low end of the range. And so if we get that back up to an optimal level, we can start seeing some of these mental health issues clear up on their own. I'll just read this out. So the driving factors around hormone regulation and the relationship with serotonin might be helpful in understanding the patient's mood pathology. So especially estrogen, I think I have this on the next slide, that estrogen really influences serotonin production. So a lot of serotonin is actually made in our GI tract, but when we're looking at the CNS, when we're looking at serotonin in our brains, a lot of that is controlled by estrogen. So serotonin interacts and communicates with estradiol, testosterone, cortisol, and actually vitamin D, which vitamin D is actually a hormone. I'm not going to get into that talk tonight. Serotonin interacts with neurotransmitters as well, GABA, glutamate, different things to that nature. But sex hormones will modulate melatonin or serotonin signaling. So I think I have this even on the next slide here. Estradiol stimulates serotonin production via this enzyme, this TRPH activation. So as you see a woman's estradiol level drop, their serotonin production you can see drop at the same time. So directly correlated. So again, if we have a patient that, again, is going through menopause or postmenopausal, usually it's during that menopausal time, their estrogen levels really start to tank, you can see a lot of these mood issues come up. This, crying for no reason. It could be depression, whatever it may be. Go and measure their serotonin level, and that's dropped as well too. So, and again, if you know me well enough, I'm the pharmacist that I don't typically recommend just putting a drug as a Band-Aid on an issue. I like to get to the root cause of the problem. So, if this patient's depression or low mood is caused by low estrogen, why are we giving them Prozac? Or, fill in the blank with whatever other drug. Because that's not the root cause of why their serotonin's low. The root cause of the problem of why their serotonin's low is because they don't have enough estrogen. Possibly, but again, I'm just fabricating, a scenario here, but why aren't we measuring that patient's level? Because we should be. So, not that this diagram matters, but there's two things that estradiol is doing. Not to get into all this biochemistry, but you got this amino acid called tryptophan. You've got an enzyme that converts it to 5-HTP, and then from there you've got serotonin. There's B6 and there's other cofactors involved that helps with this conversion. But estradiol upregulates the enzyme to go from tryptophan to serotonin. The other thing that estradiol does is it inhibits the metabolism of serotonin, so it keeps serotonin around longer. So it actually has a twofold benefit. So not only does it help produce more of it, but it helps reduce the destruction of serotonin. So, but again, are we measuring patients' estradiol levels when they go to see the doctor because of their depression? No, typically not. Sorry for the interruption. If you are finding value in today's content, I encourage you to give this video a thumbs up, and I encourage you to subscribe. Every week we're trying to put out a new video on information that's going to help you to fix your healthcare issues rather than put Band-Aids on them. Back to today's show. Estrogen works directly on estrogen receptors located in bone tissue to keep bones healthy and strong. During menopause, estrogen levels decline. That's why you can just take 100 women going through menopause and their estrogen levels are tanking. You can take those same 100 women and their bone density, put them all through a DEXA scan, and their bone density is dropping right with their estrogen. It parallels perfectly. So this lowers the protective ability, can predispose women to fractures. That to me is a no-brainer. Postmenopausal osteoporosis is an estrogen deficiency-induced metabolic bone disease resulting in reduced bone strength and increased bone loss. So that's an important thing to just like serotonin, estrogen is improving production and lowering destruction. Moving on. Okay, and then according to, I'll just read this out too, Bone Health and Osteoporosis Foundation, it's estimated that 54 million Americans have low bone density or osteoporosis. I have a whole talk on osteoporosis. I don't know what the statistics are, I always forget them, but it's something like a third of the women that have a fracture die within 2 or 3 years. I mean, it's pretty sad what happens with fractures. And again, what I'm saying here with estrogen and bone health is, and I should have mentioned this earlier, but now's a good time, is we never want to give estrogen alone. Even with the depressive patient, with the osteoporotic patient, with the patient that's trying to lose weight and boost their metabolism. We're always going to give estrogen with progesterone, and the reason for that is, even though, and we didn't talk about cancer yet, but we will in just a few minutes, estrogen causes cells to divide. I'm not denying that. And bioidentical estrogen causes cells to divide. And I never want to increase a patient's risk of cancer. And so to help, I don't want to say eliminate, but reduce that risk greatly, I'm going to give progesterone. Because progesterone puts I shouldn't say every cell, but puts many different cells in your body. Estrogen puts those cells into I can't say this word, a growth phase. So it causes those cells to divide and grow. Progesterone puts those same cells into apoptosis, into the death cycle, which is fine, right? Our tissues are always regenerating. So you want estrogen for what we just talked about so far, but you also want to pair that with progesterone. You never want to give a woman estrogen by itself. That's one key takeaway. I don't have a slide on that, but I don't want you to leave tonight going, Dan said just go on estrogen, everything will be fine.
Do you ever give progesterone alone?
You can give progesterone alone.
Okay.
We do that quite often,
Okay.
but not the other way around.
Okay.
Just so we're all
Why do
clear.
you do that?
To reduce the risk of cancer. Thank you for watching today's video. As I promised earlier, I have two very important, very simple tips to share with you. One, how to find a doctor in your area. Now, of course, you can Google it, and that's probably the answer you were thinking of, but I encourage you to call the pharmacy. We have over 3,000 physicians in the Wisconsin, Illinois, and Michigan areas that are well versed in physiological hormone balance. Give us a call. We're open Monday through Friday, 9:30 to 6 Central Time. You can speak to one of the pharmacists here, ask you a few questions on exactly what you're looking for, and match you up with a physician that will best suit your needs. Secondly, we have ZRT test kits. They're simple kits. You can again purchase those right through our pharmacy. Call the pharmacy, we can get you set up and send you that kit. And again, in Wisconsin, patients are allowed to order these test kits without a prescription, so I encourage you to do that. Also, in next week's video, we will be discussing other important factors related to hormone balancing and optimizing your wellness. One last thing, thyroid hormone balancing. It's important to know that with sex hormones and controlling metabolism and helping to optimize metabolism, we want to make sure our thyroid gland is working properly. If you haven't seen our videos on that, I will put a link at the end of this video. Thanks again for tuning in, and enjoy your weekend.